Hi, everyone, and welcome to the 5th Annual Better Lives Together Fresno Parkinson Summit. I'm Sarah Osborne. I'm a program manager for the West region of the Parkinson's Foundation. And joining me from the foundation today is Danielle Apollo, Kayla Lozano, Jenna Lennon, and Rachel Hausman. We're also very lucky to work with the Greater Fresno Parkinson Support Group on this event again this year, and they're here with us in the meeting as well. So again, thank you everyone for being here. We warmly welcome you to the program. You're not alone. Your Parkinson's community is here with you today. All right, so let's thank our sponsors first of all, who make these things possible. Kiowa Kirin, Boston Scientific, Supernus, Synovian, Medtronic, Amneal, Abbott, and Acadia. And again, thank you to the Greater Fresno Parkinson Support Group. You can learn more about our sponsors by visiting our chapter supporter page. And again, we're going to put that in the chat and share it with you after. The mission of the Parkinson's Foundation is to make lives better for people living with Parkinson's today until there's a tomorrow without the disease. We work towards this mission by supporting better care for Parkinson's, education, and research. So, show of hands, or you can write it in chat. How many of you already have an Aware and Care Kit? This guy here, the Aware and Care Kit. Some people have one. Yeah, or some of you may have some of our books. These are things that we're pretty well known for. So in addition to these webinars and the books and the Aware and Care Kit, we also have our professionally staffed helpline, which is 1-800-4PD-INFO. In addition to funding multiple outside research projects, we also work through our Centers of Excellence Network, which is our a program that we have for 47 centers in the world. We also have our own research, including this new initiative called PD Generation. And so this is a study of genetics that are involved in Parkinson's disease, and it includes genetic testing and counseling at no cost to participants. And the other thing that I want to mention is that now can be done from home. So you can even do this test in home. If you want to learn more, you can go to parkinson.org/PDGene or PD Generation. So again, show of hands or write it in chat. How many of you have participated in a walk, in a moving day walk? Yeah. So again, on our call today, we have Jenna Lennon and we have Rachel Hausman, and they oversee the walk program. All right. And then also you can contact Rachel. So this is her information right here. You can email her, you can text her or call her, and she can get you signed up. All right. So again, thank you for your participation. We want you to stay connected after the event too. So here's all of our information to stay in touch. Reminder that everything that we share with you today is also going to be shared with you after. So all those links and resources, everything, we're gonna share all of that good stuff. Okie dokie. Let me see here. There we go. Okay. So at this time, I would like to again thank the event partner, Greater Fresno Parkinson Support Group, and I'd like to invite Bruce McKee to come on screen and tell us what's coming up.
Well, thank you, Sarah. And it's really great to have you and your team help us organize a couple of really wonderful speakers that we're going to hear today, experts in their field. We're familiar a bit with Dr. Katz. She's been and presented here before. And now Dr. Ritz going to be speaking about the environmental impacts on Parkinson's. I'm really excited to hear what she has to say as well. So a couple of comments here. It seems like we are alone in a lot of ways, right? It's all of this virtual things we've been connecting with in the last year and a half almost. And thanks very much to our coach, John Bowers, who's really been active in facilitating, helping all of us find some kind of connection with each other, which has just been great. But I know most of us, including Bobby, myself, we really are missing the group, missing the connection, missing being together, just sitting next to each other, having a cup of coffee and a cookie. Those things become really, really important. And I think we're all really missing that level of connection, which is such a powerful need for humans. Bobby and I joined Parkinson's 2015 when she was diagnosed, and we got involved almost immediately with Harant and Kelly and some of the folks that began working with John and helping John get credentialed as our Rocksteady boxing official coach. And from there, it's just been a wonderful development of history, development of exercises, John's expertise in helping us stay connected, find our humor, and laugh at ourselves from time to time. Thanks, John. So the meetings, and Marcy has been really working hard with this with the help of Sarah and her team. And so what we've decided to do, instead of having live meetings in the foreseeable future, is that we're going to maintain our policy of the second Saturday of the month. So March 13th, we're going to have Dr. Z and a colleague speak, and hopefully we're going to have a colleague perhaps that has a little mental health background. It's always helpful to have a little mental health background. And then April 10th is going to be Parkinson's Awareness Month. And John, Bowers, Ashley, and Alexis are going to be our presenters for that event. And we're going to get more in terms of the exercise element, the nutrition, the wholeness. And as John continues to expand his business and his interests and horizons, more nutrition, more wellness, more wholeness, and more breathing. There's some really fascinating research on breathing out there that we all can benefit from. All right, is that good for now?
Thank you so much for that information. We really appreciate it.
Sure.
And yeah, everybody feel free to, direct message to Bruce if you have questions about anything that he talked about or the group. So thank you again for being here and for letting us know what's coming up. So I'd like to invite Maya Katz to join me on Spotlight. You can see some of those answers there, Dr. Katz. She is a board certified neurologist, so she's a movement disorder specialist who specializes in the treatment of Parkinson's disease and other movement disorders. And she's a clinical associate professor of neurology at Stanford University. So she's now at Stanford. So I would like to invite you to go ahead and share your screen, and welcome.
Thank you. Okay, so am I sharing my screen or am I going off the videos that I uploaded? Should I just share from my screen?
That would be great. Let us know if you need anything.
Oh no, I'm good with that. Let me just bring that up. Hi everyone, thanks for joining. I've had the opportunity to meet a few of you over the years. Okay, so you should see my slides. Yeah, so I'm excited to talk about holistic health and wellness. And I'm really glad that it was a question that was raised to all of you, and I really liked the answers. I think they captured a lot of what holistic health and wellness is. So today we're going to talk about the idea of total health. The concept of connection is protection, and thanks for raising the importance of that today. The role of communication in medical care, and then some wellness strategies. So the idea of total health, the way that I look at total health is actually taking from the concept that was created by Dr. Cicely Saunders in the 1950s and 1960s. And she is the founder of palliative care. She was actually knighted by the Queen for this discovery and for creating this the specialty of palliative care. And she coined a phrase which actually is the flip side of total health that she called total pain. And total pain is the all of the areas of someone's well-being that is affected by serious illness. And so total health is the flip side of that. So if we recognize that we're not just biological physical buttons that can be sort of tweaked and pushed around by different medications, which has been the focus of medical care in this country really forever, and I think is now embracing some of the concepts of palliative care and total health. And it's really kind of thinking about the fact that we're also, our health is really driven not only by physical symptoms, physical well-being, but also psychological well-being. We're psychological creatures, we're social creatures, and we're spiritual creatures. And so if we only focus on our physical health the way that I was taught in medical school, which was to focus on physical health only, we actually miss and we shortchange people, right? Because we can't just strip everything away and just make ourselves biological buttons to press. And so we need to, the truth is that something like, a condition like Parkinson's affects every aspect of our well-being. And so in order to really have total health, we need to recognize that and to address all of these different aspects equally. And so kind of starting with that, I am going to just focus on some of the physical, biological health issues that happen with Parkinson's. We know that the motor symptoms of Parkinson's is just the tip of the iceberg. And I don't need to tell you that. You all know that. And you've been trying to tell the medical profession that for a while, actually. And so we know that, unfortunately in Parkinson's now, the non-motor symptom burden is really not addressed well at doctors' offices, and is usually actually the symptoms in Parkinson's that affects quality of life more than the motor symptoms. And so we really need to address them. And then, in terms of psychosocial distress, we know with Parkinson's, there's change in family dynamics. People can feel a loss of autonomy. Isolation is very, very common and a normal, difficult emotion with any type of serious illness. And then there's difficulties accessing care, and all of this causes a lot of distress. And these are just some of the things. And I'm sure if we went around and asked, you could all bring up other issues, other types of distress that Parkinson's has caused. What about spiritual distress, right? People, when people come into my office every day, they talk about grief, they talk about loss, they talk about loss of being able to do some of the things that they loved, or just loss of their sense of self. There's guilt that people can feel. There's a lot of caregivers that feel guilt that they're not doing enough. I hear that all the time. And then there's what we call existential crisis or existential distress. And that's sort of the why me questions. And these are really, really important to address. Every single person that has a serious illness or a family member with serious illness is going to feel this. And if we don't address this, and if we don't acknowledge this as normal and help people move through it, then people can't feel total health. They can't feel spiritual health. And the one question that has been shown to really measure spiritual health is this question, are you at peace? And so I actually think spiritual health is probably the most important part of the total health package. As we know, we're limited in medical care, sometimes what we can do to help people with physical symptoms. Unfortunately, with Parkinson's, we get new treatments almost every year that are being FDA approved, and the landscape of treatment is really improving. But we can't just focus on the physical health. If we can help with spiritual health and finding peace in different ways, and with emotional and social health, then actually the physical health can get better. So it's not one or the other, actually. And then just helping people plan and prepare for the future, and giving people guidance and what that means. That can really be very healing for people. Everyone has a different sense of how much they want to prepare for the future and how much they want to plan for the future. Some people want to plan the whole 100 miles out. They want to know everything and they want to plan everything. And then some people are one step at a time, and other people are somewhere in the middle. And really trying to gauge where you are, and then being able to talk with your doctor or financial planner or anything like that to try to help plan and prepare for the future based on what your needs are. It really actually helps with kind of overall distress that people feel. So that's a big part of total health, actually, and may not be something that people think about. But it's really, it causes a lot of distress for people not to know what's going to happen in the future and how to plan for that. And then also, how Parkinson's affects the family. And we know that, serious illness doesn't just affect the person with the illness, it affects the whole family. And so really, and the way, family is really just a part of the kind of a second order patient. And so we really need to, and so supporting the caregiver and supporting the person with with Parkinson's is really important. And the idea is that I like the airplane analogy where you have to put your oxygen on first, then you can help someone else. And so a lot of the times caregivers will feel that it's selfish if they take care of themselves. And it's actually the opposite. It's actually selfless, because you can't help someone if you don't have your own oxygen mask on. And so all of those things are really the way that I think of total health when dealing with something like Parkinson's. And connection is super important. It's a super important part of that. Connection, there's a saying in palliative care, connection is protection. And so it's not just connection. I think there was a speaker talking about connection to the community, connection to, the great community that you have amongst each other, but it's connection to the self. What makes life worth living for you? What's your spark? What are your hopes and goals currently and for the future? So that's the connection to the self, connection to family, connection to community, connection to nature, and then connection to the greater, and that's the spiritual health. And so that's also a way to think about total health. And actually, we're wired to connect. There's an empathy circuit in the brain that is triggered when we're connecting with others. And so without that connection, we're lost as humans. We're actually wired to connect in community. And so it is a really hard time for people that we're not really getting a chance to do that, except for in these limited ways. But at least we're having these really great sessions. So I'm really happy that the Parkinson's Foundation and the Fresno support group is able to put this together. And so really finding what brings you that sense of peace and what brings you that sense of connection. Another way to look at it is what brings you a sense of awe. And so there's actually evidence that more time with that sense of awe is actually improves quality of life for people with neurological illness and their families. And so that might mean going and seeing a beautiful waterfall, or listening to music, or just what kind of takes you away from, takes you out of your head and brings you into the present moment and gives you that sense of connection that we all need. Super important. And then really, just kind of understanding what you need to stay engaged. And so there's, volunteering is really important, and staying engaged in your community and providing that way. Being able to just understand what it is that I've a support group that I used to run where I had a member that would volunteer at the ASPCA every week because he really enjoyed working with animals. And it was just a great way for him to be with animals. And so whatever it is that brings you that connection is super important, and it can't be ignored. We can't just say, well, my medicine is working well, and so I'm, my physical symptoms are okay. But if you don't have that connection to what makes your life worth living, then you're not really healthy, right? So that's the total health part. And then, really in terms of making the most out of your doctor's visits, these are some things that you could, think about and brainstorm about to talk about with your doctor that really can help address some of these total health goals, and that your doctor probably won't necessarily bring up because it's not something that we're trained to do, actually. So we were really trained in medical school to think about people as biological buttons. And so really expanding the awareness yourself into the fact that, we're not just biological buttons, we're social buttons and emotional buttons and spiritual buttons. And how can you kind of bring that into your clinical care and let your doctor know what's important to you? So, some of the things to really focus on is, just thinking about some of the symptoms that you've been having and focusing on some of the non-motor symptoms that you might be having that are bothersome to you. Just knowing that most non-motor symptoms are not addressed by a doctor, and that most of the time we're really taught to focus on movement, tremor, and things like that. And so it's a lot of it's going to come from you kind of bringing it up to your doctor and asking for help. So we know, for example, mood and mental health problems, 50% of the time when someone has a mood or mental health problem with Parkinson's, it's not treated 50% of the time. And the majority of that time, when we look back at like the most recent neurology note, it was never addressed. So it's not treated because the doctor hasn't asked about it. The person doesn't feel comfortable bringing it up, doesn't even know that it's related to their Parkinson's, for example. And so a lot of these issues that affect quality of life just aren't raised. And then, it's really important to share what your goals and values are with your doctor. So, if there's a wedding that you want to make sure you get to, or, if it's really important for you to get to, a vacation spot, or to, just letting your doctor know what your important goals are so that they can really understand that their treatment plan and their recommendations have to focus on helping you reach your goals. And then really helping them understand what it is you do that's important to you. For example, if it is golfing or if it is rock steady boxing, what are those different things that that kind of bring you your spark in your life? And so those things are important for doctors and to help better guide treatment recommendations, and just to get a better sense of who you are as a person. It's really, really important. And you can talk with your doctor about what kind of concerns you have about the future. So a lot of the times doctors won't ask. We don't ask because to be honest, we don't get trained in communication. Now that's really changing. I'm actually doing a lot of the training for residents and medical students in this kind of communication, but it's not something that we're trained to ask about. And so, it's important to bring it up so that, you know, the doctor can address it, or can, you know, if there may not be something that the doctor can address, but maybe there's a social worker that can help, or some other person of the medical team that can really help address some of your concerns and worries about the future. For example, I had a patient who said, you know, I want to build my dream home. I've always wanted to build it. And I was diagnosed with Parkinson's. Should I build my dream home? That was what he was worried about. And so being able to address that and say, yes, you should build your dream home. And really, you know, helping them understand, you know, what the course might be for them, and that, you know, they have plenty of time, you know, and that they should definitely enjoy and build their dream home. And, you know, that those types of things are really important to bring up, and not to let them kind of fester inside. And so it might not be that there's a clear answer, but even just bringing, you know, in this case, there was, a lot of the times there is, but it's important also to just raise and acknowledge and connect with other people about normal concerns and fears, and not to feel that they're somehow pathological, or that they shouldn't be, that there's something wrong with having worries or concerns. And I don't know if this resonates with the people that are listening, but I do hear that a lot from my patients and from their family members, that there's a lot of times where normal concerns and worries are labeled as depression or anxiety. And, you know, people are told kind of, oh, you're being overly sensitive, or they're worried about people telling them that, or they're worried about burdening other people with their worries and fears. And it's really, in order for us to move through and cope with difficult situations, we need to connect about them. We need to. And, you know, the truth is that when we have a difficult emotion, the kind of normal instinct is to withdraw and not connect. And actually, we should be doing the opposite. It's sort of the kind of doing the opposite action. You know, when we have a worry or concern, it makes us feel more isolated. And what we should be doing is actually connecting, because probably the person next to you is having a similar concern or worry. And just acknowledging that is a really, really important way to move through it. And so I really encourage people to acknowledge not just kind of hopes and goals for the future and currently, but also worries, concerns, fears about the future, maybe things that they're feeling grief over, or loss over. Just being able to share that with each other, and, you know, with your doctor, if you feel comfortable doing that, is a really, really important way to cope and to move through. And then to find a way to deal with some of these difficult things. And it's a lot of the times in a doctor's office, you may not have the opportunity to talk about your questions, you know, in terms of what to expect about the future, what we call anticipatory guidance. And it's something that causes people a lot of stress. And so, you know, not every doctor is going to be able to talk with you about this. A lot of the times people hear kind of this generic phrase of everyone's different and we can't predict anything. That's not true, actually. We have enough data with Parkinson's that we can make a lot of predictions as clinicians, and we can really help guide people over decades. And so, you know, if your doctor kind of gives you that standard statement, everyone's different, they've really just not been trained in how to talk with people about this. And so, you know, it might be something where, you know, you might want to ask for a referral, for example, to someone that has more training in communication skills. Or to in a clinic, for example, there's, I'm going to be building a clinic at Stanford where we're going to be really working with people with an interdisciplinary team that's going to include a social worker and a chaplain and a nurse, and to really help address the total health for people, and to, it's not always something that your doctor has answers for, but that it's something that is incredibly important to address. And so hopefully I'll be able to provide that. For some of you know, I had that kind of a clinic at UCSF for a while, and I'm hoping to build a similar type of clinic at Stanford. And so this is just some of the wellness strategies that I found to be helpful for people. So mindfulness is pretty kind of a trendy word these days, and I think, I worked a long time with our chaplain, Judy Long, who some of you might know. And so she really, she was teaching and learning mindfulness way before it was trendy, in like the 1970s and 80s. And so kind of her feeling is that people really forget what it means. They kind of, it's almost taking it away. The trendiness of it sort of taking it away from what it really means. And it's really about paying attention and not getting lost in the story, and not getting lost in your emotions, more like noticing things, but then being able to come back to a more neutral place. And this is a quote that I really like. It's by Jon Kabat-Zinn, who created mindfulness-based stress reduction. And he said, "You can't stop the wave, but you can learn to surf." So there's a lot of waves in life, right? So how do you kind of not get lost in the wave and get more in touch with the observer part of you? And so these are some recommendations that I have. The Headspace app is really good. It has a mindfulness for beginner course. There's a part 1, 2, and 3, and they're really short sessions, and it teaches you how to meditate, how to do mindfulness. And so I encourage people to just do it's a 10, part 1 is just a 10-step course. There are 3 to 10 minute long meditations, and you can just download it on your phone. And he also really has some great meditations to help people fall asleep and learn how to fall asleep better. And Jon Kabat-Zinn created mindfulness-based stress reduction as a pain relief technique. And that's where actually most of the evidence is, that you can actually relieve pain through mindfulness by becoming more present and not getting lost in the pain, and not actually fighting the pain, but just letting it be. And so this is a CD, and I believe it's downloadable as well, that's available through Amazon or through your app store. And it's a good way to learn how to use mindfulness for pain relief. So for those of you who are struggling with that. And I really enjoy this book called How to Relax. And it's by a Buddhist poet named Thich Nhat Hanh that some of you may have heard of. And he really also, it's a great book to just short paragraphs, short poems that talk to you about how to actually just be present in your body, and how to actually relax. And so the next one. Okay. So some of the really simple techniques that that I've learned mostly from our chaplain, Judy Long, that I worked with for a long time. So really the idea of gratitude practice. And I'm wondering who here already has a gratitude practice? Or has heard of a gratitude practice? So gratitude is really a very simple practice. It's a part of positive psychology. And so the idea is that at the end of the day, just kind of setting out a time period where you're going to think about a couple of things that made you grateful that day, that you're grateful for that day. So it could be anything that specifically happened that day, tiny little successes, little things that made you happy. And it should be something specific to that day, a specific memory about that day. So, you know, for example, if you have a cute dog, you can't just be like, my dog, my dog, my dog, my dog. It has to be something that day that made you grateful. Oh, when my dog jumped on me, it was so cute, something like that. So it has to be something very specific that just happened that day. It's a very, very simple practice with very, very powerful effects on the brain. And the way, you know, after you start doing this gratitude practice for a couple of weeks, the brain shifts and starts to look for things that you're going to be grateful for. You don't even need to do anything. It's sort of a glass half full technique. So it's actually a really powerful practice to help with just building positive emotions. And so I encourage you all to do it. I do my gratitude practice when I brush my teeth at the end of the day, because I'm not doing anything else. It's kind of, you know, brushing my teeth. Some people do it when they, you know, with their partner at dinner time. What are you grateful for today? And you can share it with each other. And that's a really nice technique. I had someone who just had like an empty bowl, and every day they would just write on a Post-it note something grateful with their housemates and put it in the bowl, and then they would see the bowl grow with lots of things that they were grateful for. So people can do it in different ways. Make it, you know, just a way that you can actually practice it every day, and you'll see that it actually has really profound effects on how you see the world. Very simple practice. How about setting a daily intention? Have people heard of this? So this is the idea of kind of in the morning at the start of your day, just setting kind of what tone you want for your day. So, or what's a way of being that you want to kind of hold as a goal throughout the day. So it can be very practical. For example, it could be, my intention is to have good posture and to have sort of mindfulness in the body about my posture. So that's a really good intention for people with Parkinson's. Actually, everyone has generally bad posture. So, and in Parkinson's, unfortunately, the, you know, posture becomes a more significant issue, can be a significant issue over time. And a lot of that actually, and so, you know, you can pick things like that, or you could pick whatever you want. You want it to be kind of like a pro-social type of thing. So, you know, it could be more calmness. You know, my intention is calmness. My, you know, my, whatever it is for you. And then, and some people can have the same intentions for a month. Every day you can be like, my intention is calmness. And just remember that throughout the day. And when you feel sort of a little upregulated, go back to your intention, right? Remember, oh yeah, my intention was calmness, and just see how that changes things, right? It's actually a very powerful technique. And then at the end of the day, maybe around the time that you're thinking about your gratitudes, kind of think about your intention. Were you able to meet your intention? And not sort of as a self-criticism, like, oh no, I forgot, but more just like large brush strokes of how it went. And then the next day, try again, set an intention again of how you want to be in the world. And you can have a different intention every day, or set one, you know, again, as I mentioned, some people have the same intention for a month and then they switch. And then the third part is creating goals for the week. So the images here are actually part of a wellness journal that our chaplain created, but you can use any journal. And so the idea is to set an intention for your physical health, your social health, your mental health, and your spiritual health for the week. And not just, oh, I'm going to do rock steady boxing, but when? Specifics. Okay, on this day and from this and this time, right? And you can do this, you know, one day, let's say you pick Sunday and you do it for the whole week. And it's best if you do it with a partner, because they keep you on track. So, you know, if you have a house partner, you can do it with them. If you have a friend that you want to connect with, and you can share sort of, you know, okay, how did it go? These were my gratitudes. This was my intention practice. And these are my goals for the week. You can go back and say, okay, did I actually do the goals? Right. And funny enough, there's sort of, you know, it's sort of like Pavlov's dog, and you can kind of like ring the bell and be like, check, 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 gold star, I did it. And that is actually very powerful to kind of go back and see, you know, if you actually were able to reach your goals. And it's very reinforcing when you do. So that's the physical goals. Social goals, you know, are a little harder these days, but just, you know, anything that is something like a Zoom connection, or maybe a socially distanced lunch date with a friend, something that you can think of that would be a social goal for you. And then a mental goal is not related to your work or doing the taxes. So it's not like, you know, some homework that you have to do, but really, you know, something that's fun for you to do. So some people like learning languages. There's actually evidence for daily crossword puzzles as people get older, and helping them reduce the risk of cognitive decline as people get older. So some kind of cognitive activity for you to write down, and then a spiritual activity. And that, you know, some people have a strong faith community. Other people walk in nature to get a sense of the greater, to get that sense of awe. But it's really, really important that we can have those experiences, and a good way to have the physical, social, mental, and spiritual experiences that we need are to really set goals, specific goals for the week. And so I would encourage you to do that. Thich Nhat Hanh, he says, smiling is mouth yoga. And, you know, I used to think it was like really corny if people were like, just put a smile on it, just smile. Seems kind of corny, right? But it's actually not corny. There's actually very powerful effects, biological effects that happen when you smile. And Thich Nhat Hanh says that when he sees someone smiling, he knows that they are in the present moment. When you smile and when you focus on having that smile, you are in the present moment at that time, right? And so just, that might be an intention for you to smile more, right? It's a really simple intention for you. You know, we talked about some cognitive leisure activities being really important, and then getting enough sleep, just as a really basic wellness strategy. I know sleep can be a big issue with Parkinson's. And sleep is sort of the garbage collection time of the brain. Super important. It actually is where the brain gets, when the brain gets rid of all the toxins that have built up. And so when people don't get enough sleep, it's possible that it may progress the disease faster. So, you know, if we actually take animals and we force them to be sleep deprived, we can create neurologic disease. And so we know it's incredibly important. This is the garbage collection time of the brain. And so, yeah, I think a lot of the times people turn to medications for sleep first. And I try to kind of take a step back and let's think about lifestyle, you know, just making sure you're not drinking a cup of coffee at 3 p.m. It's not going to be, or at nighttime, right? It's not going to be helpful. And then just trying to, you know, do some mindfulness, relaxation, just getting yourself into the mode for sleep. And I would encourage you to look at the Headspace app, and they do have some nice ways to teach you to kind of get into that mindset. The other thing to remember is, even if you're not sleeping, as long as you're restful and you find that nice, easy breath, you're resting. You're getting some of that restorative brain health. So a lot of the times people get frustrated if they're in bed and they're not sleeping, and it makes them really anxious because they're not sleeping. But as long as you're actually just resting and following your breath, and for example, there's a nice technique called paced breathing, where you breathe in for a count of 3, you breathe out for a count of 6. And if you do that for a few minutes, you will automatically activate your parasympathetic, I'm calm and well-fed part of the nervous system instead of the fight or flight part of the nervous system, like, oh my God, I'm not sleeping. So just that really easy paced breathing for a few minutes, you're getting restorative rest in that way. And so just really, really important to keep that in mind. It's not sleep or nothing. So there's interest in in nutrition, I heard. So I think it's definitely helpful to have a nutritionist. What we know is that the Mediterranean diet is the most healthy for the brain. So that's very little red meat, maybe once a month, mostly, simple, try to limit simple sugars. And so more focus on the white bread is, out, and whole grains are in. And so what we know is actually those simple carbs increase the risk of prediabetes, and that makes Parkinson's progress faster. And so, kind of heart health is brain health. And so, trying to maintain healthy nutrition and keeping your cholesterol as well controlled as possible, and your blood pressure as well controlled as possible, and your sugar levels as controlled as possible, all those heart health stuff is really, really important in brain health and actually affects progression. So this has been shown to be the best. So people with a Mediterranean diet hasn't been studied in Parkinson's per se, but we know that people who eat primarily the Mediterranean diet have bigger brains. So these are older adults, they have bigger brains. They have just lower risk of developing serious cognitive issues, and they live longer. So there's biological changes that happen. And so, I talked about trying to limit fried, processed foods, trying to limit simple carbs, animal meats and fats. And really, actually, all dairy is high risk because it accumulates pesticides. So even organic dairy, because the cows, they're eating the grass next door to the non-organic farm. So they're getting the pesticides. And so actually, Dr. Carly Tanner at UCSF showed that she can predict Parkinson's risk based on the amount of milk someone takes in during their life. So it's a real thing. And so I would encourage you to try alternative sources of dairy. And then, the exercise, it sounds like, thanks, John, for being there for these folks and really helping, making sure that they're getting the exercise through Rocksteady Boxing really combines everything that you need. So you need balance, stretching, strengthening, and aerobics. The one thing that has been shown to delay Parkinson's progression is high intensity aerobics. So that's based on your goal heart rate. So usually 120s, 130s is the goal heart rate. It depends on your age, actually. And so the study was 2 hours a week with high intensity aerobics, maintaining that heart rate, delayed progression. So it's neuroprotective. It's really changing the way that the brain is working. It's helping it work more efficiently. So there's that 2.5 hours a week goal of moderate to high intensity exercise, like challenging exercise. That's from the American Heart Association that we use for brain health, but specifically for neuroprotection and Parkinson's, it's the high intensity aerobics that is actually changing the brain in a positive way. Who's doing high intensity aerobics? I bet some of you are if you're doing Rocksteady. So, but I encourage you to really look into that and to make that, you know, the goal is 2 hours a week, but, you know, if you do 30 minutes a week, that's good, right? So you got to, it's not all or nothing. You want to build up and make it sustainable. So I really, really encourage you to add in that high intensity aerobics. Right. And we know Tai Chi is the best treatment to maintain balance in older adults all around the board, and especially in Parkinson's. It's better than physical therapy. It's better than just regular exercise. So I encourage you to try Tai Chi. And there's a link, actually, the PD Active group has a Tai Chi group, a Tai Chi class that it does online. And so I think Sarah's going to be sharing that link with you. Okay, I think I might be running out of time. Okay, there's forced exercise. So the idea is that people underestimate how much they can exercise. I think that's probably across the board, but really in Parkinson's as well. So basically, this is the tandem bike trial where they had someone with Parkinson's in the back and a physical therapist in the front. And what they showed was that the person with Parkinson's could meet the rate of the physical therapist, and that when they did that, when they went on the bike themselves, they were faster. So sorry, they themselves were faster, and it improved their cognition and their balance. So forced exercise and kind of pushing yourself more to do more than what you think you can do in terms of aerobics is super, super helpful. It's like, it's really taking that neuroprotective benefit and really multiplying it. So just, I guess the idea is that your brain's going to tell you that you can do less than you really can for most people. Okay. And then dual tasks are really important. So the idea is that, you know, it's hard to chew gum and walk at the same time, right? You know that saying? It's really, really helpful if you do it in a controlled way. So rock steady boxing is a dual task, right? So you're remembering the steps and then you're doing the steps, right? So any activities that you can do with a physical therapist or with a trainer that are dual tasks, you're getting like 100 times the benefit as if you were just doing a cognitive task or a motor task. When you put those two things together, it's really synergistic for the brain. It improves cognition and it improves balance. So I would encourage you to do that. Okay, these are the online wellness programs through PD Active, and so they have Tai Chi. This is the Tai Chi class that I recommend people do. They also have Pilates and yoga. And I think Sarah's going to share a link for that. And so in conclusion, just kind of the main points is that, you know, really, we're not just biological buttons, and that our health has to include our social health, our emotional health, and our spiritual health. And if we don't, we're shortchanging ourselves as humans. Right? Sometimes, you know, if our social and our social health and our spiritual health is really, really robust, it can actually make our physical health better. And in fact, we published our palliative care clinical trial where we had people get kind of a flip of a coin, either get palliative care for a year or what we call usual care, which is just your typical doctor, primary care doc and primary care. And we showed that not only did we improve people's quality of life in all of those total health domains, we also improved their movement. People moved better. They had more on time, their tremor was better controlled, their walking was better. That was a surprise for us to see, but in some ways not a surprise, right? It seems like you really don't have to choose between these different types of health, that if you work on your spiritual health, you're helping your physical health, right? You can do all of it, and it's all equally important. Remember, connection is protection. And that doesn't, you know, of course, that means to a great community like the one you have in your support group, but it's also connection to yourself and connection to the greater and connection to nature. Those are all so important in our resiliency, right? We want to build resilience. Communication is really important with your doctor And stay tuned for our interdisciplinary supportive care clinic that I'm building at Stanford to help with that. Because, you know, just to be honest, I had 0 days of training in how to communicate with people in my, in residency, even though I talk to people every day. So, so it's really just a training and a comfort level for a lot of doctors. And that wellness builds resilience, and resilience is how we bounce back, right? So it's not about, wellness isn't about how much you can endure. Wellness is about how you thrive. So, all right, well, thanks so much.
Thank you so much, Dr. Katz. That was really a great presentation with a lot of information. I noticed that we didn't have a whole lot of questions right now. I'm quite sure that's because everybody's processing and thinking about all of these things. I know I have a few questions for you that we can do in the Q&A. Now, let's take a quick break. Let's do like a 5-minute stretch break here with John, and then I'm going to introduce Dr. Ritz. Okay, John.
Right, and I'm spotlighted. Hello, everybody. I'm John Bowers. I'm the coach for the Rock Steady Boxing Central Cal program. And I want to just say a few things, and then we'll get started with some breathing and some stretching, get moving. Rock Steady Boxing is a lot more than just boxing, and it's yoga, it's dance, it's any type of movement. Sarah, I really appreciated what you say is whatever movement or whatever exercise that you will do. And that's across the board. Biking, you know, obviously swimming, it's wintertime, can't do that now. Walking with a friend. It's so important. Anything that you can do, we got to get active. We do everything from battle rope to TRX to hitting the bag to yoga, burpees, squats, lunges, and to Dr. Mike Katz point, rigorous exercise is what we're looking to do. We're trying to get out of our comfort zone. All exercise is good exercise, but the exercise that gets you tired and kicks your butt is the best, and that's what we look for. Usually after every class, I ask somebody here, are you tired? And usually the answer is yes, and I say, good. That's the goal. I want to wear you out, get you tired. That's the most relaxed you'll feel, and at least what I've seen and on my end, most relaxing part of my day is right after a workout. Kick my own butt, and just all the stress, angst, anxiety, all that stuff just kind of gets put on the back burner. So really encourage anything and everything. And there are a lot of things out there. So we've been working on the breathing aspect with a lot of our exercises. And today we're just going to do more of a stretching, and we're going to sync our breathing up with our movements. Okay, so starting off, everybody up nice and tall. Okay, really focusing on the posture. And let's take a few seconds just to work on some deep breaths in, and then we'll add a little count to it. Okay, so deep breath in. Nice, slow, controlled, and exhale. Exhale through the nose or the mouth. Deep breath in. And out. Let's get one more. We'll start adding things to it. So deep breath in. And out. Now that we got a little bit of that pace, let's add some stretching and movement with it. So as we're inhaling, we're going to reach up with one arm. Inhale, reach up. Nice and tall. Exhale brings the arm back down. Switching sides. Inhale, reach. Exhale, down. Let's get one more big one each side. Inhale, reach up. Look up slightly if you can. Exhale, back down. One more. Inhale, reach. Exhale, back down. Okay, continue on with that tempo. We're going to inhale and reach back behind us. Okay, so inhale, reach back. Exhale, back to center. Nice and tall. Inhale, reach back. Exhale, back down. Take your time. Nice, big, deep breath in. One more time each side. Inhale, reach back. Exhale, back to center. We have one more. Last one. Inhale, reach. And exhale. Let's get into the spine, back, and core. We're going to do a little cat-cow from the seated position. I'm going to turn sideways so you can see what's going on here. As I inhale, I want to look up, push my belly button forward, really thinking about rounding that spine forward. Inhale up. Exhale, I'm going to do the opposite. I'm going to roll my back and tuck chin down to the chest. Feel that big stretch down the back of the neck, go down your back. Inhale up. Exhale down. Let's get two more, nice and big. Inhale up. Really exaggerate that movement. Exhale down. One more time, nice and big. Inhale up. And exhale down. Tuck that chin in. Good. Show you a great stretch for the neck. So let's take our right hand, and I want you to grab your seat. Grab your chair. Okay? Now, second thing we do is posture up nice and tall. All right, and then let's get a gentle tilt to the left. Okay, so we're anchored down on that right side. I want you to really try to relax through that right shoulder and just a gentle tilt to the left. Okay, we'll hold here for a few seconds and then we'll add some breathing with some movement in there. All right, so keeping that tilt to the left as you inhale, look up. Feel that increase. And as you exhale, I want you to try to bring your chin down to your chest. Again, try to stay nice and relaxed through that shoulder. Inhale up. Exhale and down. Pull that chin to your chest. One more time, last one. Inhale up. Oh, big pull. And exhale down. Good. Back to center. We're going to switch sides. Left hand grabs the chair. Okay. Second thing, posture up, nice and tall. And let's get a gentle tilt to the right. Again, trying to stay relaxed through that left shoulder. Should be feeling that stretch from the ear all the way down through the shoulder. And let's add our breathing. So inhale, looking up. Exhale. Pull that chin down to the chest. One of my favorite stretches on a stressful day. Inhale up. Exhale down. One more time, nice and big. Inhale up. Exhale down. Good.
Okay, so we're all stretched out now. We're ready to go. I'm excited to introduce Dr. Beate Ritz. She is the Vice Chair of Epidemiology, the Epidemiology Department at UCLA, and she's going to talk about her research into environmental exposures and the role that they play in Parkinson's disease. So her work does focus on health effects of occupational and environmental toxins. And she's also working on the Parkinson's registry, which some of you may have heard about here in California. So thank you, Dr. Ritz, and welcome.
Thank you very much, Sarah, and especially for the chance to talk to an audience like this. It's very exciting. So I'm Beate Ritz. I'm actually in both the School of Public Health and the School of Medicine at UCLA. And I've been working in the Central Valley. That's basically every other epidemiologist goes all over the world. I go to the Central Valley. So, and I keep coming with my group, with my students, with my staff. And we're very excited about the kind of research we have been able to do over almost 20 years now. I am actually a member of the Center for Occupational and Environmental Health at UCLA, and that's a state-funded center specifically to study toxins. And I'm their epidemiologist. And I was also the president of the International Society for Environmental Epidemiology for the last 4 years. And so my specialty really is the environment and occupational health. Okay, so why are we worried about pesticides, and why do I keep coming to the Central Valley? Well, we know that annually pesticides are consumed worldwide in many countries at a very high level. And you can see here that China definitely outpaced the US in its use, in the tonnage of use of pesticides. But we are pretty much almost the second highest user of pesticides. And here we have our lovely California and the Central Valley. And you can see that we have a lot of use. The darker colors are more use and the lighter colors are less applications in agriculture. These are all agricultural. But for the US, it's important to realize that even so, we're not in the Midwest where we are growing corn and soybeans. We are using about a quarter of all the pesticides used in all of the US. So in this strip of land in the Central Valley. So we definitely are a very agricultural intensive area and very productive area. There are 3 of the counties are also the most productive in the US in terms of agricultural production. But we do need a lot of chemicals, or at least the industry believes they need a lot of chemicals to grow our food. And why would that be a problem? And well, you know, this is an old meta-analysis. Actually, I used that to get my grant from NIEHS. They are from the year 2000. And already here you can see anything that's on the right of this line says there's an increase with Parkinson's disease, with pesticide use and Parkinson's disease risk. And they may be as high as 3 to 6-fold or as low as 15% increase. These are studies worldwide that were done over before the 2000s, just mentioning that, you know, pesticides seem to be linked to Parkinson's. And so the overall estimate was that the risk is maybe increased 2-fold, that rural living contributes 60% risk increase and farming maybe 40%, and this is worldwide. Old studies. So why then did the NIH decide to actually give me money to do this work in the Central Valley? Well, it was actually the Institute of Environmental Health Sciences that started funding this, and they kept funding us with investigator support that I got myself and my colleague, Dr. Bronstein, who is the movement disorders director at UCLA. To collect over a 15-year period. We started in 2001 and the last funding ended in 2015. Over that period, we assembled almost 850 relatively new onset Parkinson's cases, all living in Kern, Fresno, and Tulare counties, which are shown here. And we also collected controls, and I really want to thank everyone who's not a Parkinson's patient and ever considered participating in a study, because it's really important. because we need to compare what's happening to the patients or what's happened to the patients in the past to what actually happens to people who don't develop Parkinson's disease. That's how we do this. And almost 1,000 individuals, most of them community controls, actually allowed us to collect their data and their blood and their urine. So thanks to all of those committed individuals from your communities. And that's basically what we've been doing. We've been going out. Dr. Bronstein and his fellows from UCLA have been seeing every single one of these patients at least once, a lot of them 2, 3, 4 times. And we also, my staff has also collected information from these individuals in hour-long phone calls, and we can't thank these patients enough because they're really spending a lot of time with us. And of course, also the same was done with the population controls. Why did the Institute give me this money? Well, because California is special in many ways, not only in its agriculture and its use of these chemicals in agriculture, but also in its standard setting control systems, control of pesticide use. And in 1974, the pesticides use report system was mandated by the state, where a commercial applicator, and every farmer or farming group is considered a commercial applicator, has to actually report when, what, and how they apply pesticides. And these are maps, and you can see these are hand-drawn. So my students collected lots of these hand-drawn maps and then turned them into computer images. This is a computer image of this hand-drawn map, or part of it. And you can see here that little communities are surrounded, like Shafter, are surrounded by fields. That's what we see when we come to the valley, right? And here we are seeing what types of crops are grown, like orchards, and these are orchards, and these are tree crops and field crops. And we can then overlay this with the pesticide use information, and we can see if you're giving us your address, and these patients and controls all provided us with addresses. We can map you with Google Map here shown, and we can then draw a circle around your home, and we know how far away from your home or your workplace pesticides have been applied and how much of them have been applied. And we've done that back to the 70s for every single person who enrolled in our study. So we know exactly what kind of pesticide use was done around their homes, around their workplaces, and how many years and how much they were exposed. So these are the maps I showed you before. We can map all the pesticide use, we can map all the individuals, and then we combine it. And do we really know whether you're exposed or not? Well, this is a 2006 paper from an EPA monitoring exercise. And in this small town of Collier, you see these little flag things here. These are monitoring stations on top of elementary schools. And they monitored 50 different pesticides over the year. And you see one of these seasonal pesticide applications, and these are the detects, so the bars, the kind of bluish bars, what they detected by monitoring on top of these schools, and then these little purple pinkish boxes are what was reported according to the use by agriculture around the community. And you can see that what was reported lines up quite nicely, unfortunately, with what they are recording. So I believe, at least for these pesticides that they monitored, what is being applied in the end ends up in the air, somehow ends up into the breathing space of human beings. And that's what we've been looking at. Then the next question is, what kind of pesticide should you be worried about? And that has also been suggested 20-some years ago, actually, as being possibly agents such as paraquat, rotenone, monep. And why? Well, because we have our furry little friends, these mice and rats, that actually were dosed, or cell models of neurons that were dosed with different agents. And there's actually a rodent model of paraquat that is called a Parkinsonian model. So you can give these rodents Parkinsonian symptoms by dosing them with paraquat. It works even better when you add MANEP. And there's also a dosing model for rotenone, which, by the way, has been sold as an organic pesticide to be used on your tomatoes and in your garden. It's organic because it's from a tree root in Africa, but it's highly toxic. So it doesn't mean that organic means non-toxic in this case. We actually used the system of exposure assessment that I showed you already in the 2008-9 period. And this is one of my students who published this paper. And she was able to show that paraquat alone increases your risk maybe 20–30% to have Parkinson's. But when we are looking at people who live near fields where paraquat and MANEP were used, the risk went up to 75 or 80%, and it went up even higher depending on what your age at exposure was. And actually, people who were exposed at younger ages had a much, much higher risk. So we also got money to look at genetics, and we combined genetics with these pesticide exposures. And here's one of these examples. This is results from a colleague who showed that if you had a genetic risk and you were exposed, that's when your risk was 5-fold. This is a 5, and it means 5-fold risk of Parkinson's, but you had to be exposed to pesticides. They did not say which pesticides. We repeated this after having these estimates for the pesticides, paraquat and MANEP. We repeated this. And you can see here that those individuals who had high exposure near their workplaces or their homes and had this genetic risk, 1 risk, 2 risks, they were either 2.5-fold or 4-fold higher at risk. So this is a nice example of showing that, yes, you also have genetic susceptibility, but the genetic susceptibility is listed here, increases your risk maybe 30–40% more. But when you're then exposed to the pesticide, that's when your risk goes through the roof. Okay. We also investigated another risk factor for Parkinson's, and that was head injuries together with pesticide exposure. And you can see here, yes, paraquat alone increases your risk, maybe 30–40% increase in risk. If you have a traumatic brain injury, a head injury that actually knocked you out for at least 5 minutes, that was the question we asked our patients, then you also have an increased risk, maybe 60% risk increase, and they stack up. You can add these risks. But then when you had both, a traumatic brain injury as well as pesticide exposure, in this case paraquat, that's when your risk is 3-fold. So there's a synergism between these agents. You're not only hit once, you're hit twice, you're hit 3 times, and they stack up in a way, these risks, but they also go beyond it. So they make your risk together much higher. And why should we worry about pesticides? Well, I don't have to tell you, I already said it. You're surrounded by these chemicals because of broad-based agricultural use. But I also want to point out that those of you who may be living away from fields might be getting exposure through your diet or other means. And we have this US survey that every 5 years measures urine content of all sorts of toxins, including pesticides. And you can see that here in the 2000 time period, it was an organophosphate that 96% of all US samples had in their urine. Now it's changed. We now have a different type of pesticide to worry about, the neonicotinoids. And they were found also in a large population in the urine in 2015-16, telling you 2 things. Pesticides don't go away. The type of pesticide we may be exposed to changes over time, but the older you get, the more you're exposed to one or the other or both or multiple pesticides in your environment. And not just your environment, but also everywhere else due to agricultural use. And this is another example where we looked at a different type of pesticide, these organophosphate pesticides and genetics. And you can see here it's stacked up in just exactly the same way. So where you have a lack of an enzyme that gets rid of this organophosphate pesticides really fast in your body, if you don't have the capacity to get rid of it, a low capacity, that's really when your risk is really high of developing Parkinson's. And we could repeat this also with household pesticide use. So this is where we looked at what was agriculturally used around your residences and workplaces. This is self-reported, and it's stacked up in exactly the same way. So self-reported use in your home or your garden. We also found that not only the risk of Parkinson's was increased, but also your risk of developing cognitive effects while you are having Parkinson's. So your cognitive abilities declined much faster when you were exposed to these pesticides. And we also found that well water consumption, so if you're drawing water from your own well, you had an increased risk when you lived in the Central Valley and these wells were surrounded by pesticide applications. So that's one of the papers that specifically looked at the individuals, and about 20% of all individuals in my studies reported using private well water. And depending, of course, on the depths of the well and whether they're close to fields, there was contamination that probably contributed to their risk as well. Now to something completely new, and I call it the changing face of Parkinson's disease. When I started my work 20-some years ago, this is what Parkinson's disease was. It was really motor symptoms, right? You were diagnosed, or you're still being diagnosed, because you have your tremor, you're stiff, you have instabilities that make it hard for you to walk, and you maybe start falling. That was what Parkinson's face was. Now we know that maybe long before you develop these motor symptoms, you already have sleep problems. You already have possibly depression and anxiety. You may develop cognitive problems relatively early or late, hopefully late after the onset of Parkinson's. And this is what a lot of patients, of course, worry about. But you also have gastrointestinal, you have gut and bowel problems, right? And these gut and bowel problems can come prior to all of the motor symptoms. And some epidemiologic studies show that these symptoms actually might happen 20, 30 years prior to you developing all of your motor dysfunction. And why is the gut? This is the colon, the large intestines. These are the small intestines. What links them to the brain here, right? Well, there is a nervous system that connects your intestines to your brain. It's called the parasympathetic nervous system. And that nervous system tells your bowels to move and transport your food. It also tells the brain whether you should be hungry, or the brain tells your bowels to get going because, there's hunger. So there's lots of communication between the brain and what happens in the bowels, and there's a lot of communication between bowels and brain that we didn't know about maybe 30 years ago, but now do. And also this around here, those are bacteria. And we now know that really the gut is a bioreactor. This is really a huge organ of our body. These bacteria are a huge organ in and of themselves that digest everything you eat or swallow. And a lot of things we could not as humans even digest or use as food if it wasn't for our little friends, the bacteria that break it down for us. But they're also breaking down or activating pesticides and anything else that gets into your system. And and also this system interacts with your immune system. And we have here a paper that I contributed to that showed that in Parkinson's patients, the immune system is probably quite active, and it also ages faster than in controls. So what do we know about the gut and Parkinson's? We know that it's affected, that your bowel movements are affected, not in every Parkinson's patient, but in lots of Parkinson's patients. You have much slower bowel movements. We also know that the bacteria in your gut digest your food and also contribute to either activation or breaking down of toxins that may get into your bowels and may actually be taken up into your system. And so the big question now is, all of these pesticides I referred to before, is it that these pesticides really have to get into your system to act as neurotoxins to affect your brain? Or is it something these agents, these pesticides also do to your gut, so that your gut communicates with your brain in a different way, sends it different signals, or that these pesticides change the flora of your gut? And actually we have a little bit of that already seen in these very preliminary results, that there are differences in that community of bacteria in the gut of Parkinson's patients versus controls, but also in the community of individuals who had a lot of pesticide exposure versus those who had less. So the community of bacteria in your bowels may be shifted because not only of what you eat and what you otherwise are exposed to, but also because of toxins that then favor certain bacteria over others. We are also interested in seeing how your medications are actually doing a similar kind of thing, meaning shifting the bacteria, the ecology, the fauna of your gut in a way, in one way or another, in order to then also contribute more and more to what's happening to the gut in Parkinson's disease, meaning slowing it down further or giving you more trouble. So that said, I think what we need is we need to go to a system of regulating pesticides similar to pharmaceuticals, at least in areas that are so heavily used, have such heavy use of pesticides like the Central Valley, because we're introducing them specifically into the environment to harm insects or to harm plants. And we should be making sure that we're not harming the humans that are living there and that are breathing the air, that are exposed to the dust, that are exposed in many different ways to these pesticides, and are more or less bystanders or active participants if you're a farmer. We should know about this, and the chemical industry that is selling these kind of agents should have some kind of system in place to know when what type of application is maybe not the best way to do this, and to reduce really the exposure in the communities. These are all the people who contributed, and you can see I have lots of students, many of them coming out into the Central Valley. These are very old pictures. This is when we started. This is at my house. You see, I live in the countryside as well. And this is at UCLA more recently. And we have Dr. Bronstein with his colleagues, Dr. Bordelon and Keener. And we have also the geneticists, Dr. Howes and Sinsheimer, and my postdocs who have been contributing to all of this work. And we just got refunded. We call it the PEG Brain and Gut Study. It started last fall. And what we are wanting to do now is add more patients to these 850 patients who have been most recently diagnosed, and now really concentrate on what is happening, not just in their brains, but also in their gut, and to find out what we can do to help these bacterial communities in your gut do a better job and also keep you healthy. Thank you very much to all of our funders and to all of the patients.
Hi, I'm Jessica with Move Up Health and Fitness, home of the Rock Steady Boxing Fresno program, and today we're going to get dancing. So the only rule is that you just have to keep moving. Okay, we're going to go through these super fast, so just do the best you can. All right, so our first dance, we're going to do a march. So you're going to pop up the knee and bounce for a 2 count. 1, 2, 3, 4, 5, 6, 7, 8. Okay, and then we're going to go step out, step in, and then bounce the shoulders. Okay, so it's out, in, 3 and 4, 5, 6, 7, and 8. Okay, so we'll go back and forth with that. Then we've got a roll with a march. We'll do that for several counts. It goes 1, 2, okay, 3, 4. And then we're gonna do hitchhiker. So you're gonna go 1, 2, 3, 4. So it's a double on that third one. Okay, so it goes 1, 2, double. Okay. Then we're gonna hit disco fingers. So you're gonna start with that left finger up. So you're gonna go 1, 2, hold here for 3, and then you're gonna look at me for 4. Okay, so quick review, 1, 2, 3, 4. Okay, and then we're gonna go into hands. So we've got a quick transition. We're gonna go here, 4, 1, 2, 3, and 4. 1, 2, 3, and 4. Okay, going back into that roll, going through all of that again. Then we're gonna go into the feet again. And we're gonna get back to our disco fingers. Okay, and then you're gonna go 4, and then it's chicken. We're gonna break for the song. So we're gonna be here for about 16 counts, a little bit more than that. And then we're gonna go ahead and march it out. Okay, and then we get right back into it. Okay, so that's that song. All right, ready? Let's go. 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, and 4. 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 2. Make it your own. 3 and 4. 2, 3, and 4. 2, 3, and 4. 1, 2. Last one. And roll it out. 1, 2. 2. 5. We're gonna go hike. 1, 2, 5, 6, 7, 8. Disco. Hands. Roll it out. 3, 4. Hike. 1, 2, 6, 7, 8. 2. Disco. Feet. Last one. Roll. Hike. 1, 2, 3, 6, 7, 8. 2. Disco. Chicken. 5, 6, 7, 8. 2. 5, 6, 7, 8. We're gonna march it out. Right here. 7, 8, step. 2, ta, 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 5, ta, 3, and 4. 1, 2, 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 3, and 4. All right, great job, guys. Next song. All right, this next one is a little complicated, so just do the best you can. I'm going to show you all of the steps, and then you're just going to follow along, okay? So the first one is going to be a swim. And so we're just swimming. Okay. And then we're going to put up a wall and we're going to peek. okay? And then the wall goes away, we're surprised, it comes back, and then we're climbing, and it goes 1, 2, 3, 4, and we do that a couple of times. And then you're gonna go 1, 2 for a scan, 3, 4, okay? 1, 2, 3, 4. Then we're gonna do the eyes, 1, 2, 3, 4, 1, 2, 3, 4. And then we're gonna jump out. We're gonna go 1, 2, 3, 4. And we do that a couple of times. And then we're gonna go brick wall, and then you're gonna give me eyebrows, and you're gonna look around really suspicious, but I want those eyebrows moving. Okay, and if you wanna dance with it, you can, but you're hiding behind this wall, all right? And then we go back into the swim, and we go back to the top, okay? So it goes through that a few times, and then we're gonna be in the swim, and we're gonna hit a break, and so you're gonna do breaststroke, and then snorkel, okay? And it goes 1, 2, 1, 2, 1, 2, okay? So they're all 2 counts, or maybe 4 count for the breaststroke. And then we're gonna go, okay, so then you do snorkel, and then you do your scissor here, okay, and scissor here. And then we're gonna shimmy, and then go shimmy. And then there's gonna be a pause, and then we're gonna jump out again, okay? And we go back all the way through. There's even another going through the whole thing, okay? So just follow along, do the best you can. Let's do it. 3, 4, 1, 2, 3, 4, 5, 6, 7, 8, climb. 1, 2, 3, 4, 5, 6, 7. We're gonna scan. 1, 2, 3, 4, 1, 2, 3. Eyes. 1, 2, 3, 4, 1, 2, 3, 4. Jump out. 2, 3, 4. 1, 2, 3, 4. Wall. 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Scan. Eyes. 1, 2, 3, 4. Jump out. 1, 2, 3, 4, 5, 6, 7, 8. Wall. 1, 2, 3, 4, 5, 6, 7, 8. Breaststroke. 1, 2, 3, 4. 1, 2, 3, 4. Snorkel. 1, 2, 3, 4. 1, 2, 3, 4. Scissor. 4, 2, 3, 4. Shimmy. We're gonna jump out. Here. 1, 2, 3, 4. 1, 2, 3, 4. Wall. Swim it out. We're gonna peek. Climb. Scan. Eyes. Step out. Wall. Swim it out. Nicely done. All right, on to the last song. So we're gonna go through these super fast, okay? So you're gonna do a shimmy and a finger, and you'll do that to either side. We've got a goodness where you go, ah, okay, something like that. We've got a kick, and you're just gonna kick it out. We have a 2-step where you're clapping, step, clap, big step, and then you do the other side, little step, big step, okay? We have, we're gonna do a pause shimmy here, And then you're gonna give me a little bit of a pause here, and then we're gonna go mine, 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 okay? So you're gonna fan yourself and bounce your legs. And then we get to a break, and you're gonna do jazz fingers, and then it goes 1, 2, 3, slide, 1, 2, 3, slide, 1, 2, 3, slide, 1, 2, 3, slide, up and down, and then we just jazz it out. Okay, so you're actually hands and legs are bouncing as you bring it around, and then we're gonna slide it out and we go into our 2-step. Okay, you got this. Let's do it.
You shake my nerves and you rattle my brain. Too much love drives a man insane. You broke my will, but what a thrill. Goodness gracious, great balls of fire.
Pick it up.
I let you love all I thought it was mine. You came along and woo, now honey, I changed my mind.
Goodness.
Great balls of fire.
2-step.
Kisses, baby. Feels good. Oh, my baby.
Pause it. Shake it.
You're fine. So kind.
Mine. Kick it out.
I'm real nervous, but it sure is fun. Come on, baby. You drive me crazy.
Goodness.
It's just great balls of fire.
2 little fingers. 3-step. Slide. And then up, down, and jazz it out. And then slide, and 2-step.
Feels good. Oh, baby.
Pause. Shake it out. Mine. Kick it out. Goodness. Shake it out. Good job, guys.
The first question is for Dr. Katz. We heard a lot about this. We heard this term palliative care a lot, right? Is this an interchangeable term for holistic health?
Yeah, that's a great question. I think that if you ask someone who is in palliative care, the answer would definitely be yes. Palliative care is kind of the founder, Dr. Cicely Saunders, the founder of this idea of total health and bringing it in to modern medicine, and really was the first person to say that people are not just biological buttons, that where we need social health and emotional health and spiritual health to feel healthy. And, we can't just have all of our electrolytes looking good. That's not enough, right? That shortchanges us as humans. And so, yeah, it really is that approach. Palliative care is a team sport. So you have to work in an interdisciplinary team to provide total health for people. There's a huge stigma around palliative care just because it came from hospice. And so those principles of taking care of someone's total health came from taking care of people who were really very, very sick. And so when people hear that word, they think someone's like throwing in the towel, and it's actually the total opposite. It's that extra layer of support that people need. And really it should start at day one of, at diagnosis. People should know that they're being treated as a whole person and not just being seen as their diagnosis. And just recognizing how important that is. I prefer to just use the word supportive care, just get rid of the stigma. Or wellness care, or I had one referring provider who just called it 360 care through the 360 clinic. So it just needs a new brand, but yes, it's that concept and that philosophy that is really now spreading into, I think, all parts of medicine.
Thank you for that clarification. Right. We want to know sort of what are these terms so we know what to ask for, right? So, okay. And then the next question is for Dr. Ritz. Actually, we have a few questions. So people are asking, what is the end goal of this research? And so I wanted to kind of ask you, I know you're very involved with policy and advocacy. So what do you want people to know about policy and advocacy and their role in the end game? What is the end game?
Right. So the early questions, of course, were, does chronic exposure at low levels, as it might occur because you're living near applications, really affecting the brain in the long term? And I think we learned a lot over those 20 years, but convincing policymakers takes even more evidence. And, so part of what we do is we just keep collecting more evidence to make the point that we need to keep humans away from these toxic agents that we are introducing into the environment for a good purpose, to grow our food. But maybe there's a way to do that it doesn't expose the workers, it doesn't expose the communities, or maybe there are choices where we really should choose the least toxic and the least harmful agents. And we definitely, and there's integrated pest management that the California agencies are promoting, and there are lots of incentives to actually change agricultural practices to bring down exposures or to prevent exposures, especially also exposures to private wells, or to very sensitive parts of the community, such as schools, but definitely also the elderly. And you want healthy aging. And if you want healthy aging, we need to concern ourselves with this issue of broad-based introduction of neurotoxins into the environment that is not good for the developing brain, and it's not good for the aging brain. So that's the eventually, and I think that the industries that make a lot of money selling these products should take responsibility in the same way that pharmaceutical industry does, because they have to do after introduction studies to make sure that the pharmaceuticals are actually not harming, or if they are harming, the risk is really, really low. And in the same way, I think we should do this with these other toxic agents in the same way. So in the end, we want to influence policy, public policy. We want to influence how standards are being set, how the agricultural farming communities are using these agents, and really protecting the community. That's what I would like to do. My other aim as an MD is also to help Parkinson's patients specifically. I mean, I've spent my career with Parkinson's patients, so I want to learn as much as I can from this research to help them. And how do we help them? Hopefully by stopping the progression. So I want to thank again all of the patients who have come back again and again to us and told us how they are doing and what they are doing, so that we can learn how eventually maybe we can stop this disease from progressing.
Right. Thank you for that. So then the other question that we're getting sort of in follow-up to that is people want to know, what are these pesticides that they should be aware of, and how could they potentially limit their exposure? Is there some sort of, I don't know, list of things that are being investigated that we might, and how would we avoid those things if we're aware of them?
Unfortunately, I believe that if you're living close to fields, there's very little you can do, except grow a lot of high trees around your home to, keep the dust away, or keep whatever. But even that, the wind may blow it over the trees into your homes. So I think at the individual level, interventions are not as likely to help if you're living where you're living. However, of course, as I said, there's genetic susceptibility. There's also diet, healthy diet. We know that probably the gut microbiome does a lot to either detoxify or help or activate. And, if we understand that better, maybe we can change the diet so that we can counteract some of these exposures. But that's what we want to learn with this new study. How do we, help people have a healthy digestion and as healthy an environment as we could hope for?
Right. And I see some follow-up questions about, air filters, water filters. I know I've heard Dr. Caroline Tanner also talk about, changing the clothes. I mean, how much do you recommend these sorts of measures?
I do air pollution studies, and I know that air filters work to reduce particles in the air. And they also have an effect on health. They reduce the adverse outcomes, but then you have to stay indoors. And, we want people to be able to go outside and do exercise. And, vitamin D is good for you. You should be getting your sunshine in your yard. You shouldn't be locked into your home, right? Because you're afraid of farmers applying these pesticides next to you. So yes, all of these interventions at the individual level are probably better than nothing and reduce exposures. But generally, I'm in public health. I believe we need to not just do these individual actions. We really need to come together as communities and support public action that saves the most lives and helps the most people, meaning really keep this stuff away from humans.
Great. Thank you, Dr. Ritz. And I know you have to run to another meeting. We really appreciate your time. I want to remind everyone that Dr. Ritz's information and her study is in the chat. If you would like to learn about participating or becoming involved or anything more about that, please do visit that information.
Yeah, and I would like to say we have a website going live in a few weeks. We need the human subject approval for it. We're waiting for that. That's why you probably won't really find my study yet described in the way that I did. But in a few weeks, it will be online and I'll share that information with you.
That's great. Thank you so much.
Thank you.
All right.
Thanks for having me.
Yes, thank you for joining. And then Dr. Katz, the next question, we have a lot of nutrition questions about the Mediterranean diet, particularly, what if we're on a budget or what are some things that you would recommend to make a Mediterranean diet accessible for everyone?
Yeah, I mean, I think, McDonald's supersize is probably more affordable, and we know what happened to the supersized guy and his liver after eating on that diet for a month. So yes, I think, it's really access to healthier food is, there's a real problem with that. I think that there's harm reduction. So, it's not all or nothing. I think that what you can do, you should do. There's the Dirty Dozen and the Clean 15 I think it's called the Clean 15. So we can give them that. So there's there's a list of fruits and vegetables that are worse, that tend to accumulate more pesticides. And then there's a list of fruits and vegetables. Most of them have kind of a harder shell that are safer to have. So focusing on the Dirty Dozen is a good idea. And just doing as much as you can. I mean, we have to, just acknowledge that, access to these different diets is not equitable. But as much as you can, I think, yeah, focusing on the dirty dozen is a good idea. And just, harm reduction. It's not all or nothing.
Exactly, right. So then the next question is for John and Jessica. John, would you tell us where you're located and what you offer? And then Jessica, could you tell us the same, please?
Yeah, okay. So we have, we're online. We have 5 Zoom classes a week, Monday through Friday. We have 2 yoga classes and 1 dance class. We're actually also meeting at the park twice a week. It's at a park, Maple and Shepherd, doing our social distancing, and it's nice to be outside. And we are back at the gym, a small group. Our gym is at First and Hernan, which is north central Fresno, right off of the 41. We're inside of a Fitness Republic in a martial arts studio, which is about 4,000 to 5,000 square foot, nice, real big area. And there's a small group, about 5 or 6 that are meeting in there. Most people are still doing the Zoom because they feel more comfortable. But we have a, just a little variety of that. And what we do is everything from burpees to battle rope to medicine ball slams to speed bag to yoga to dance to bear crawls to planks to everything, anything and everything. So as I said earlier, it's much more than just boxing. Boxing is a good portion of it, and it's a fun side of it because people do enjoy hitting things, especially when we're able to go to the gym. But there's so much more to it. It's just exercise. It's all movement.
And Jessica, same question for you.
Okay, so we have a few different programs, just as same as John, kind of the nature of the beast right now. You have to have online programs. So we do offer Zoom workouts. We also have in-person classes starting up next week again in our parking lot. And then when we're allowed to be indoors, we'll be inside we have a facility that we have access to. So in our program is really kind of focused on small group training. We don't allow more than 10 people in each class. And we have multiple coaches for those individuals to make sure that they're getting individualized attention and feedback. We also started offering an on-demand program where people can have access to the videos. They don't have to make it to the classes. So that is available online at our website, so you can check that out. I posted our dance video on there, and it's 14 days free, so you can check it out and see if you like it. And if you don't like it, you can cancel it. And if you love it, then you can stick with it. And then we also offer a support group. So there's the Greater Fresno Parkinson Support Group, and then we have ours. It's the Movers and Shakers of Fresno. We offer ours the first Saturday of every month at 11 a.m. So that is virtual right now. When we can have in-person meetings again, we'll be at our facility, and we're off of 99 in Ashland. So we're more Western Fresno, kind of in the middle, like between North and South. And then, of course, I have to mention that we are doing a moving day team. So check us out. It's Rock Steady Boxing Fresno. We're going to have a bunch of fun activities. So if you're interested, sign up for our team. You'll get our newsletter, and we'll keep you engaged and active, and we'll do it for a great cause.
Thanks to Dr. Ritz. Thank you to Dr. Katz, John Bowers, Jessica Tax. Thank you to our sponsors, Kiowa Kirin, Boston Scientific, Supernus, Synovian, Medtronic, Amneal, and Abbott, and Acadia. Thank you to the Greater Fresno Parkinson's Support Group. Everything's going to be sent to you after. Thank you for staying 5-10 after. We appreciate that. If you had a question today that was not answered, please reach out to us at 1-800-4PD-INFO or email that helpline@parkinson.org. You can use that same information to order our free resources. Thank you again for joining us, and stay safe, and we hope to see you again soon.